The two most important technologies that we use in controlling the vaginal laxity are the laser, either in the form of a diode laser or a carbon dioxide laser. They cause mini or micro ablation of the vaginal epithelium, which heals by neocollagenization and fibroblast accumulation. Therefore, there is a tightening of the vagina and also the rugosity come back. The rugosity do appear good. There is a good moisturization and the secretions which help in the lubrication. The other procedure that is done to achieve the same result is the vaginal RF. In this, the source of energy is through an RF, and it causes a non-ablative rejuvenation by targeting the fibromuscular layer, and there is again a neocollagenization, and there is a fibroblast density increases, circulation improves, not only the circulation, the vaginal overall health improves and sensitivity also improves. This can be used both inside the vagina and to the labia to decrease the wrinkling of the labia and to give a proper shape. So these two technologies give very good advantage for both for the client and for the doctor with minimal downtime. We always discuss about vaginal laxity, but around 50% of the cases with vaginal laxity also present with the SUI, that is urinary incontinence, that is stress urinary incontinence of menopause. When they laugh or cough, the vaginal laxity draws down the bladder base, and this can cause a leak from the urethra. Apart from the musculoskeletal, as the musculoskeletal system overall in the menopause is affected because of the estrogen lack, the same principle applies to the vaginal walls and the vaginal muscular system. Therefore, there is a deficiency in the musculature which causes this kind of a stress incontinence. This can also be targeted with a non-invasive technology called RF vaginal treatment. This vaginal treatment involves an application of the RF with a targeted probe so that the bladder base is treated along with the vaginal wall, and this gives support to the bladder base, and the bladder musculature improves, the circulation improves, and this causes a lift in the bladder base and the urethra. Therefore, the urinary bladder control is very good and the leakage comes down. This also can be used in the vaginal as a part of a vaginal laxity with double benefit of treating the urinary incontinence.